Good morning. Kelsey's going to join us. Just waiting for her to come on into the room to have a great old chat about oral milestones. Morning, everybody. This is usually Kelsey's spot. I'm coming in to join her for a conversation today. Hopefully she'll be here to run the show shortly. We're waiting. There she is. Hello.
Hello.
Morning, Kelsey. Good to see you.
Good to see you. Okay.
You're the regular Friday morning Myo Munchee host. I've just jumped into your seat today.
I am. I'm looking forward to this chat, definitely. It's going to be great. So, should we jump straight into it?
Sure.
Okay.
Why don't we?
Yeah. Well, we are a minute early. Is that okay?
Oh, we can just shoot the breeze for a moment.
Yeah.
I'll tell you what I've been doing.
Yeah.
I was at an audiometry nurses conference yesterday.
Ooh.
And I got to present about otitis media and chew, swallow, breathe. So that was pretty cool
That's
to
very
share the information and understanding we have around the importance of the functional side of things. And they were really interested, and that was great. And I got to speak before the ENTs, so I sort of set them up with all the functional side of things, and then it was great. It was really interesting.
That's wonderful. That's really
Yeah.
exciting space to
It's
be
fun.
in. Yeah.
It's fun.
Amazing. Well, yeah, I love this chew, swallow, breathe that we're working on, and that's where we're going to jump in today. And but I'll introduce ourselves first. So I'm Kelsey Green, a speech pathologist, orofacial myologist, and I also work as a Myo Munchee clinical advisor, but this space is more my parent advisor. So on these Friday chats, so we are focusing in more on parent tips and tricks in this next 15, 20 minutes probably. But I'm joined today, so excited to be joined by you today, Mary, CEO of Myo Munchee, to talk it all through. So we're thinking about the oral milestones in babies, from babies to 2 years today. So we're talking sucking, chewing, teething, working into that mature swallow pattern, drinking from a cup, as well as then getting to that chew, swallow, breathe coordination by 2 years. So hopefully some tips and tricks shared. But any questions, pop them in the comments and we'll answer them at the end in a bit of a wrap-up Q&A.
Great.
Good.
So a quick intro for me. Yes, I am the CEO of Myo Munchee, but just to give a little bit of clinical background, I'm a chiropractor. I've been in practice for over 34 years. So my passion and interest in my work was always early development. And so it was been very exciting for me over the last 10 years to dive deeply into the world of orofacial development and how it relates to brain function and all that kind of thing. So I've loved working with people like Kelsey as a speech pathologist and orofacial myofunctional therapist. So yeah, we're learning all the time from each other. So yeah, great. Let's have a conversation. I can't hear you. Something's happened with my volume. Hang on. What's happened there?
You got me?
Yep, got you back now.
Okay, I just had an alert across the page, so maybe that was what it was.
Okay.
Well, let's start right from birth. We'll talk through the role of sucking and why you believe it's such an important first milestone.
Yeah, great. Love to talk. So basically, the baby in utero is practicing the suck and the swallow. They're getting that really working with the amniotic fluid, so that functional movement. So really understanding that we as humans, movement is a huge part of what enables our optimal expression in the world, and that really starts in utero from that little fetus starting to form. And for those who've had babies, yeah, you then start to feel all that movement going on. And so when the development is occurring around this, this is the central piece of that development of that human, even in utero. So the suck and the swallow with the amniotic fluid is practicing that functional movement. And then when they arrive in the world, they've got to coordinate it with the breathing. And then that's all that survival wiring and that very base brain stem function is enabling that to work, because it's very complex. And you know how hard it is to solve when the problems are there. But that's what it's meant to do when they first arrive. That brain patterning and that suck, swallow, breathe is the very first functional foundational movement of human life. And everything else really develops from there. So that's the first very important piece that we have to do as much as we can to support the mum and the baby to really get that first part happening well, because it is a foundational piece for us.
Yeah, and so you mentioned the suck, swallow, breathe, but could you give some insight on maybe the effective, what an effective suck in a newborn looks like?
What an effective suck in a newborn looks like. Well, it's really about that tongue engaging, and that's what really should be working so well. And that swallow, it's about that latch and then that really functional suck swallow, and that's where the people who are really specialised in this early space can, because babies are very adaptive, and we have these survival mechanisms where we'll work out how to do it some way, how to get nutrition in. And we are very blessed that if they cannot breastfeed, we're able to bottle feed. But it's a very different thing to actually the functional movement of the sucking involved in breastfeeding. And it's quite unique how the breast is able to be pulled back in and then compressed up against the palate, back part of the palate, activating all of that vagal tone. And the vagus nerve, people probably hear about this concept of the vagus nerve. It's all of our digestive system. And so it gets activated at the back part of the soft palate with that tongue pressing up. And that really gets all that digestive system starting to get ready, and getting all that wiring in really well. Like, it's all very immature when they arrive. There's so much that's got to occur. It's all there with the right inputs, it'll get established. But sometimes when that incorrect swallow is there, or suck, let's start with suck, pattern is there, we can find that it doesn't ideally activate and get the cascade of perfect outcomes. And that's where we want to get the best support in around those, the dyad, as they call it, and those who work very specifically in that early support, like lactation consultants are such a phenomenal resource, because it's such an important one to get right, especially for those new mums. Just reach out and find the people who can support.
Yeah, and those people would be your IBCLCs here in Australia, or your international board certified lactation consultants, and if you are concerned more around like ties and things, you might be reaching out and looking for someone with the orofacial myology background and understanding. I know in my own personal experience as a mum, where I got the change and the support was from chiropractor, from yourself actually, but it was having a body worker involved through those early stages. We realised there was a lot of postural tension that was impacting my daughter's suck, not necessarily the tie at that point. So I think it is, just like you said, finding those people. If you feel in your gut as a mum that something's not quite right in that early stage, newborn, we're talking up to the 4 months, but it's really in those first few weeks establishing that suck, swallow, breathe. That's great. Thank you for that. But then we're moving on to the chewing, which we want to start seeing, I guess, around that 4 or 5 months. Is that and starting those early chewing movements. So what do the early chewing movements look like in your eyes and your mind?
It's a good one to talk about, because as we were saying before, that we will adapt around if we're not getting really good suck, effective tongue function. And one of the reasons why that can occur is if you have got an issue with tethered oral tissues, things like that, or it can be strains and tensions, and that's where the chiropractors, osteopaths are phenomenally helpful to help unravel and help you decide and know what else we might need to do here to get that ideal outcome. But one of the things that'll happen is that babies will chomp to stabilise if they can't get that tongue really working well. But in an ideal world, what happens is that the tongue is working really well, and it's in that forward, backward plane for a start. That's the motion that they're working with. And as they start to get a little bit older, 4 to 5 months, and the tongue starts to stay in and separate out up to the palate, and these chomping responses, which are there, the chomping responses, they're called the phasic bite reflexes. Now, they're little reflexive movements in that way They should really start to be really activated, and then they want to be integrated. We don't want these reflexive movements sticking around in our life. We don't want to put a finger in our mouth and then we automatically start to chomp. We want to be able to consciously decide, and these reflexes need to be integrated into the system. So we need the suck responses to be diminished and the chew responses to be activated, or the reflexes to be activated fully, so then we can integrate them and get much more functional chewing. So about that 4 to 5 months, that's where they're sticking everything in their mouth. And you want to give them lots of experience of chomping on different textures and all those teething and toys and things. And this is what's going to start happening at around that 6-month age, is that they'll start to get the teeth. But we need to stimulate all of that area to really get these chewing responses coming in really well, and that tongue starting to lateralize. Because what have they got to do? They've got to start to manage food. And that's what the chewing is starting to do, get some strength, get some stability. And it's all about getting all the brain messaging back to the brain about all of this area here and how to manage it and how to start coordinating it.
Yes, yeah, and you just touched on like the hands in the mouth. Like sometimes we're like, oh no, they're starting to suck their thumb or they're sucking their fingers. It's like, actually, no, they're exploring their oral, and that's fine at this age, and we love that. So the more hands are in, or your hands as the caregiver, and I know you've got a favourite tool at this age. That would be the BB Munchee. By 6 months, I guess we love that one in, but I know we tried it with my daughter at around the 4 or 5 months, and it was really beautiful. My daughter actually got teeth at 4 months. So she had her first 2 at 4 months, and that was, as a breastfeeding mother, challenging, a wake-up call. But that's where we brought in some of these other chewies alongside the BB Munchee, and the stick of the BB Munchee, because she just wanted everything and anything in her mouth. So I saw a real difference between something like a ring that we were given and her almost getting frustrated and not getting what she was seeking by putting something in her mouth, than something long like this. I have lots of different things, and we even used feeders or spoons as teethers, some silicone spoons, because then it was getting her familiar with where we're going to go next, which is that 6 months, and brings us into the next 6-month chunk that we're. Do
you want to talk a little bit about the gag response with those tools, Kelsey, that you're talking about showing there?
Yeah, so I guess that stimulation of all in the mouth. These ones are moves the gag backwards. So the gag is quite prominent at the front for these younger babies, and as they're getting to push into solids, starting to chew and eat, we want to reduce that gag and sort of integrate it, as you were talking about before with the other reflexes. So the longer sticks, I guess, stimulate the back, not just the front, to get them moving things backwards to where we want to chew and swallow. Yeah,
that's right. And so understanding, that gag response is a survival response, and it's normal. We need it. We definitely want it, but it should be back further. If you're getting gagging right up the front, that's telling us that nervous system hasn't quite integrated, and that's where you might need to get a little bit of support. And the earlier we spot there's a little sign, then that's great to go and talk to someone. Okay, how do we help to integrate that so that you don't struggle so much with solids? Because that's definitely part of it, is getting that wiring in the brain so that they're not fearful around food. Because, and lots of parents, I'm hearing this a lot now, parents are nervous and worried about introducing solids, and understanding that choking is a normal response. That's what we want that gag response to do, is to go, oh, that's too much. But we want them sticking their hands and everything in there so that the brain learns where that point of safety is. And so it's through exposure. So that's what's great about all those tools you're putting in there, is that the brain's learning and it's getting all the messaging to go, yep, I'm okay, it's all safe, back to this point where my airway is. So that's great.
Yeah. Oh, so that then it takes us to 6 months. We are talking about teething, and it can be like quite a big milestone for a lot of families. And it's teething and teeth coming in, I feel, is such a broad spectrum, and something I guess I learned, 'cause my daughter having teeth by 4 months, but then some of her friends and family not having their first teeth till 12 months. But that period around 6 months is usually when they come in. What do you, well, how do you think that teething like supports oral development, and like what comes
Yeah.
with teething? Yeah.
I think it's seeing and understanding the teeth. The teeth are like little biofeedback. They're picking up information. You know, when the little babies and they're like, you know, they've got their teeth and they're grinding them against each other. That's the brain working out how those teeth relate to each other. So basically, when your teeth are coming in, this is a three-dimensional space that your brain is trying to coordinate where exactly those teeth land in relationship to each other. And it's and it's not a random thing. We're actually all programmed to have an ideal class 1 bite. Historically, that's not happening as much as we would have seen ancestrally. And the big things that are happening are that there's environmental influences. So something to be really aware of, if you're using a dummy, this is the time to really get that out of the equation, because the suck reflexes have really integrated now. We want those. And so sucking isn't the primary movement anymore for this age group, where it's still for feeding, for breastfeeding, that's all still super relevant. And bottle feeding, if that's how that's going, that's fine. Keep that going, but minimise the amount of time they spend doing sucking, because we need to move to the chewing responses. And if you have a pacifier or a dummy sitting in their mouth, it will impact the way the messages are able to get back to the brain. So the brain's trying to locate and work out where everything lands, and you've got something in there that's kind of putting it into a bit of a holding pattern. It can't quite read the information. So in an ideal world, the tongue has separated back out up to the palate, and then the teeth start to come into the arch form, and the tongue should be forming the shape of the palate in an ideal world, because that palate's really malleable and pliable. We know that, don't we, with little tiny ones. So it's a really good time to diminish the use of the pacifier, get that out of there. And then the teeth are eventually, by the time they have them all at 2, they're going to provide this real stability for the jaws and the upper cervical spine. So what we want is those teeth to come in their alignment, and then they give nice vertical height through here. And they should all come in order. But as you say, there is a little bit of variety around that. You're not going to get too worried if the teeth don't land perfectly in the timing. It's more just making sure you're giving enough stimulus, like you said, hands, tools, lots of opportunity for stimulation for the brain to go, oh, yep, this is what's happening, and minimise what's sitting in there for hours.
Yeah, no, definitely. And Myo Munchee have got the Why Children Must Chew handout. So if you comment chew in the comments today, that will be sent to you in a link. And it is one of the best resources. And I love that it's been updated just recently, because it's often when I hand out to my under 2s family, and even older, but like Why Children Must Chew. So if anyone wants that, just comment chew in the comments, and we can you'll receive a link automatically. But once we have got that teething underway, we are starting to move into, I guess, around 10 months, mature swallow pattern. We have touched on it a little bit, but when we talk about babies developing that more mature swallow pattern, what are we meaning?
Yeah, what do we mean, the swallow? Who knew? Well, you obviously did, because you're a speech pathologist, and speech pathologists are the ones who really know about swallow and how to work with a dysfunctional swallow, because it is something we do thousands of times a day, and it does involve muscles. And when it works well, that's great. But when it is not working as well as it should, and it's more, in this adaptation, or, a compromised function, then that's when we can end up overworking other muscle groups and things, and start to affect down the track. But so in an ideal world, what happens is that the tongue, as I said, separates out, sits up into the palate. And every time we swallow, it really should be a very tongue-focused movement, not using a lot of facial muscles at the lips, not using the shoulders to have to help manage the food back. And so there's a lot of information coming to that swallow to coordinate it. from the brain once again. And that should be starting to get that proper mature swallow. So when they're younger, they might have this tongue thrusting forward, as it was with breastfeeding. The tongue would come forward to bring the nipple back in.
Yeah.
We want that now to stay inside. We don't want it thrusting out beyond the teeth. So it stays inside the boundary. And we want that back part really activating. And the sides of what we call the pharynx, the pharyngeal walls, should be coordinating that with the tongue moving sideways, managing it. There's a lot going on. And I don't want to talk too much detail because I know that the speech pathologists are really, so everyone to know they're the people who know all the detail. And Kelsey's here, she can go into more detail. But understanding that you want to see the baby managing the food now. You don't want that pushing forward anymore. And if they're continuing with that extrusion reflex, we want to go, okay, what can we do to help them learn that mature, because it should be coming in and they should be managing their food, their saliva, the drinks, all these things should be going in and being managed. So not all dribbling out the front and minimal going back. So about 10 months, we want to see that starting to really get nailed in. And once again, the pacifiers will have an impact.
Yes, yeah, we've had a few questions already about the pacifiers. We'll get to those ones in a minute, but because I think that mature swallow does come into when we're talking about drinking from an open cup, and ideally having our kids drinking from open cups from 12 months of age.
Yeah.
And it's messy, but it's such an important piece of the puzzle to get the kids all the way through, not just at this 12 months. I feel it's really interesting. Kids love a drink bottle these days, so we're losing it when we're getting into older kids. We are focusing on the younger ones though. So drinking from an open cup from around that 1 year, when they're starting to increase their water intake on their other liquids away from milk and formula. Why do you see open cup drinking as such an important milestone?
Yes, it's really getting the management and awareness. If we've got more than a third of all of our motor sensory brain information coming to the lower third of the face, the more awareness. We want the skill set we need for life. And it's the lips are a big part of that as well. It's very different experience. Yeah, it's all these different experiences we need of managing the fluid in an open cup. Yes, it will be messy to start, but you're just putting off the inevitable. You do want them to be able to do that in life. We need to be able to drink from an open cup, even though we as adults spend a lot of time sipping out of cups that have lids on them and contain these days. It's understanding their functional movements, their whole movements. We want to make sure we get what tends to happen. Yeah, there's conveniences and things. Yes, they're getting the fluid in, but are they getting it in a way that they get the management and understanding that a 12-year-old, yes, it will be a bit messy, but you've got to start the process. If we wait till they're 3 or 4, the programming for that's actually we have these windows of opportunity when they're ready. And I think that's part of it too. Understanding when the brain's ready for the information is the ideal time it gets picked up. If you bring it in later, it's not as easy to teach something because you're trying to put it into a system that's moved past that. Yeah. So that's why I think it's so important to have these conversations around the oral milestones. There's moments in time and we want to jump on them and they're ready for that.
Yeah.
And that's what's important to kind of go, oh, okay, well, we'll start doing some of that.
Yeah. Yes. And those open cups, I guess it's like we're talking about moving away from the suck. So if we have the sippy cups and those sort of things, we're still promoting that suck, whereas an open cup, they have to drop the jaw and open. A few tips and tricks, because I feel this is a big question I often get on my social media, but also in the clinic. How do I get them started? My key ones are egg cups or shot glasses. This is our favourite one. This is where Poppy started, was a little tiny cup. I saw a tip the other day too, by I'll have to find who it was that I saw it. It was just on socials, but I know it to be true, is if you fill the cup a bit more. So a smaller cup will be less mess, but filling it, and so they have less anticipation, is a really big skill to learn. So bath time with small cups, as much as we don't want them drinking the bath water, it's a really great time for learning this skill. And another one, so these small silicone cups too, I guess that was our step up. So we did shot glass of egg cups first, and then to these ones. So
Yeah.
they're two of my tips, two of my favourites.
Yeah.
Yeah.
No, that's great. And I was talking to Dawn from Easy Peasy the other day, and she was saying one of their cups has it's conical inside, so actually it has less, so they haven't got to work as hard to get it out. And I think
Yes.
that's a really good point, isn't it? Fill it up so that they can get easy access to it, and they haven't
Yes.
got to go as far back because they're trying to work out how to manage it in the mouth and the swallow. So yeah, great tips there to but definitely
Yeah.
worth moving on to these things. Now, have we got some questions going on there? I can see one there.
Yep.
What is the best way to transition from the dummy and thumb sucking if the baby relies on it to fall asleep? Yes, that's always the trick, isn't it? Very
It's a
important
big
with the
one.
sleep. I think the thing is, and it depends on the age, we're not going to take thumb sucking away from a child if that's what they're using to self-soothe and to self-regulate. It's really the length of time and making sure that it's minimized and not staying in there. That's actually what we're really looking for. And for those who, and this is sort of, definitely up till one, there's no issue really with minimal use of the sucking. And if they're going to sleep with a pacifier, taking it out, you do not want to have a situation where they have that in there all night, that back and forth in there, because it's the duration and frequency. Thumb sucking is a different story because they're using that thumb to stimulate something. They're very clever. So it's looking and hoping that they minimise the use at some point. If they hang on to it, that's when you're probably going to get some support from someone like Kelsey, who's going to have a look at, okay, what's underneath that? Why are they needing that
Yeah.
stimulation? Because it's normal when the sucking is the primary function, but really that should integrate. And as long as the other responses are settling in, the chewing and upregulating, the nervous system shouldn't be looking for that.
Yeah.
But if they are, that's telling you that something hasn't quite landed in there. And sometimes it's just really simple to do a few bits and pieces to get that nervous system back in balance.
Yeah, definitely. And then I guess if they land in my rooms, I'm often looking at how is their airway. So a lot of my thumb suckers or dummy that are prolonging that sucking habit, we are just checking in with an ENT most likely on what, and looking at if there's ties, looking if there is any airway blockages, because those things are seen to also act as a bit of a splint and opening the airway while kids sleep. Something to be very aware of. If we're taking that out and they don't have their tongue supporting that airway to be opened, their tongue's still laying low because of a tongue tie, those sorts of things. So best way transition though, it depends on the age of the kid, it depends on how dependent they are. I think, if there's a lot of, that could be a whole Friday chat, couldn't it?
Yeah, definitely, because there's no set way to do it. It really depends on the age and the stage and what else is going on. And that's something that's particularly if you've got a 2-year-old, for example, that the parent's like, there's no easy way. So the easiest way with a dummy is to minimise use from about 6 months of age. And allow the rest of the developmental phases to come in. But once you do get that bit older, and that, like Kelsey has said, you do need to start looking at, okay, why hasn't that need for that suck response diminished? What need are they trying to meet? And sometimes it can be propping that airway. And so it's about, finding someone in your community who can support you, and you're only putting off the inevitable. It's not going to get any better, sadly. It's not like they just grow out of it at 3. They don't. You could still have a child who's very much using a pacifier at 3. And yes, got to find what's the why underneath and support the family to meet the needs for the child to be able to come off that. Now we've probably gone way over time there.
We haven't actually gotten to chew, swallow, breathe, the coordination at 2. We've touched on it. But do you want to explain that, just a bit of a summary of what that chew, swallow, breathe that we want it to is?
Yeah, it's very much about chew, swallow, breathe. We should be able to, children shouldn't eat with their mouths open. We should be able to chew our food, swallow our food, coordinate the breathing. It's a complex process, and it should get wired in by the age of 2. It should be there. We shouldn't have dribbling, drooling, mouth breathing while they're eating. We shouldn't have the mouth open, food going out. So it's really understanding. And once that's wired into the system, it becomes automated, and it's in our brain as what we call a central pattern generator. So the brain has these programs that it lays down that we can then utilize. So what you want is that your child has that as an automatic response. When they're eating, they're chewing, swallowing, breathing, and that coordinates, and it ensures we're not mouth breathing. It ensures the food gets into the right places and the air, because that's quite complex inside here, that the tubes are very close together, and keeps all the neurology of the information coordinating all of that. And so it's such an important movement pattern. It's equivalent to walking and talking. You need to be able to do it without thinking. And it does lay down the ability to walk and talk, actually, if I think about it. Chew, swallow, breathe is required for walking and talking and eating and all those things.
Yeah, well, yes, there's a swallowing and breathing are ultimately the two things that keep us alive. So they're pretty important. It's what I talk to my families about. No, but that's amazing. Like, yes, we could talk all day, I feel. This is a snapshot of what we are and what the Munchee team are incredibly sharing with the world. But if you do want that summary from Why Children Must Chew, again, comment chew below and you'll get a link automatically. So don't forget to do that, because it is a fantastic resource to have as a parent, as a clinician. But yeah, I think we should stop there. But thank you so much for joining me on these Friday chats today, Mary. It was wonderful. I believe we're bringing more over the next few months with a few different speakers and interviews. So yeah, looking forward to that. So,
great.
Thank you.
Thanks, Kelsey, for all your sharing with the fabulous parents out there doing, raising the next generation of fantastic chewers. Well done,
yes.
you.
Have a great Friday.
Thank you.
Bye.
Bye-bye.